Well, let's get started today. Again, thank you so much for being here. We have a very exciting announcement today in a new launch of Freedom Open Access, which we think is going to help you and differentiate you in the market. Before I get started, just one housekeeping item. If you have any questions during the presentation, on your top ribbon on your screen, you should see a little box with a question mark. You can put your questions in there and I will go ahead and answer your questions at the very end. Sometimes when I see a question, I'm not going to even look at it because sometimes when I see a question, it just throws me off. So I will try to answer everybody's question at the very end. So let's get started. First of all, I always like to talk a little bit about who is Allied. Allied National has been in TPA for over 50 years. We were acquired in 2020 by 90 Degree Benefits. 90 Degree Benefits is a Blue Cross Blue Shield of Alabama company. And what happened around 2020, 2019, 90 Degree Benefits went out and purchased about 14 different TPAs around the country. Most of those were self-funded large group TPAs, and Allied was one of the last of the 14 that was purchased by 90 Degree Benefits. And really, they were very interested in Allied because of our niche, because Allied focuses on the small to mid-size group size, and they wanted to add that to their large group portfolio of plans. Blue Cross Blue Shield of Alabama, the 90 Degree Benefits has over 700,000 members today, over 2 billion in managed claims, and also claims processed $3.6 million worth of claims processed in the last year. 90 Degree Benefits is one of the top TPAs in the country. The Allied products that are now part of this 90 Degree Benefits is, again, for that 2 to 125 employer space, our contracts are 12/21. So that means our contracts are 12-month benefits, and then there's a run-out period for 9 months. And why that's important, we're going to get to a little bit later, but those claims run out. After that claims run out, we will pay the employer back any surplus that's in their claims account. So that 21 is kind of important there. Our carrier, our stop box carrier, is rated A at best. We have over 150 employees here at Allied National. In our office, we have 2 offices. Our main office is in Overland Park, and that's where the majority of our people are. And Allied National is a little bit different than other TPAs because Allied National is like what we want to call a full service TPA. We do everything in-house. We do the underwriting in-house. We pay the claims in-house, client services, marketing, legal. We have MGU services all under one roof here in this office. So that makes us a little bit different as well. Oops. And what I'd like to do is just give you a little bit of a history lesson on what we've done. Sorry, I keep going back and forth. At Allied National. There. So Allied National, as I mentioned, is over 50 years old. Allied National started in 1970 with the Ashley, Mr. and Mrs. Ashley. They basically started Allied National, and they started Allied National Insurance. It was called Allied Group Insurance Trust for small employers. So they have been focused on small employers since the very beginning when they started in 1970. In 1980s and 1990s is when they really started building their full TPA services, and always still, keeping that small to mid-sized group in mind. Don't pay attention to the screen right now. I'm sorry. Here we go. And in 1990, Allied National became incorporated. So now Allied National is a TPA in this small to mid-sized group space. We started the Funding Advantage plans in 2010. And the Funding Advantage plans, we made them level funded because prior to that, we were doing fully insured plans. We wanted to give the small to mid-sized employer another option. We wanted to cut those costs for those employers to make insurance more affordable for them. It's the same time that the ACA came around, and we thought this was the best options for small groups. So we went to the level funded, one of the really first adopters for level funded for the small group. Funding Advantage in 2011, we utilized reference-based pricing. Now, Allied National had been utilizing reference-based pricing on other products prior to that, but in 2011, they brought that to the Funding Advantage plans, again, to make these plans more affordable for the small employer. We introduced the healthcare assistant in 2019, but we just didn't leave it as what it was in 2019. We kept building to the services, and you're going to see that later on. And then in 2020, we celebrated our 50-year anniversary, and that is also when we were purchased by 90 Degree Benefits. In 2022, we introduced a hybrid plan. In the hybrid plan, we're going to go over a little bit more, but basically it is a combination of a provider-only PPO with the free, the open access plan for the larger claims. And now today, still innovating and bringing new ideas and new products for that small to mid-sized group to help them utilize great services and also cut their costs. In 2026, today, we're introducing the Freedom Open Access Plans. So our product suite and focus is not changing. You must have heard me say small group to mid-sized group a couple of times already. That focus hasn't changed, and our product suite hasn't changed. We have a suite of services or products that can fit any employer's need and any employer's budget. So if you have an employer that just really wants to provide benefits to their employees, but doesn't have a lot of money to spend on, healthcare, we have our MEC plan, the minimum essential coverage. Maybe they have part-time employees they want to provide for. Maybe they have a set of workers that don't have, benefits today that they want to provide benefits to. They can carve out and carve out and provide these benefits. So it also satisfies their ACA Part A. So it's a MEC, minimum essential coverage. The base plan is $46 per employee. And then there are buy-up options that the employee can buy up on. If they want a little bit more of products, they can go to the cost saver. Cost savers limited benefit products. And within that, there's a bronze plan, and the bronze plans will satisfy the A and B part for ACA compliance. So again, a little bit cheaper, a little bit more affordable for someone that just wants to give their employees something that will get them their preventative coverage, couple doctor office visits, and maybe even prescription drugs, depending on what plan you choose. Both the MEC and cost saver are guaranteed issue plans. You have to meet participation, and it has to be an eligible company, but it's no medical underwriting. So those are nice to have, super easy to get, issued. And so those are those two. Now we go into our major medical, which are going to be our Freedom Open Access plans and also our traditional PPO plans. Again, these plans are for the small to mid-sized group, 2 to 125. The MEC plan actually is 5+, but it can go higher than 125. It can usually go up to about 500. Our stop loss carrier, again, is A-rated. 100% of the employer's surplus within their claims fund is sent back to the employer. So remember I said our contracts are 12-21. So at the end of that runout period, the claims runout period after that 21 months, any unused claim fund is sent back to that employer at 100%. We don't keep anything. We don't say you have to renew with us. That is their money, and we pay that back to them in a check. We have a choice of national networks for our plans. We have that hybrid plan we're going to talk a little bit more about later, but we have the hybrid plan that has the provider-only network plus the open access around it. And then we have our new Freedom Open Access plans. Our plans, because of our variety of plan designs and the way that you can customize the plans, we have about an 85% retention rate on our plans. So all good plans. And we, as far as the refund, about 40% of our groups get a refund. So really trying to get the employees employers good plans that they can that their employees can have great benefits. So why are we here today, and what is the problem that we're trying to solve with the Freedom Open Access? You're seeing it everywhere you go, the rising healthcare costs, the complex and restrictive provider networks. If you go to look at a provider network with one of the national providers, you have to really look to see what network you're getting, because there's variations of different networks within, the brand name based on the product that you're getting. And those are getting skinnier and skinnier. And then employers are forced between cost and quality. They want to give their employees good coverage, but it's getting so costly for them. They either have to jack the deductibles way up, and then the employees can't even afford to get care, or they have to go to a plan that doesn't provide as many benefits. So we want to help with that. We have a solution that we think that will help you bring a great product and accessibility to their employees. So Freedom Open Access, what is it? It's a cost-effective strategy built for both for the employer and the member. And that's super important. You have to take care of both of them. It's a network alternative solution. I mentioned we had national networks. Well, this is an alternative to a national network. The pricing for the claims is data-driven and transparent pricing. The member is first. As we built this, we thought about the member first. So we thought about the support that they need from every aspect of their coverage, and we built that first, and then we moved everything else around it. And this open access eliminates limitations of traditional PPOs. There's no network, it's open access. You're free to go see any provider you want, no restrictions. So what is Freedom Open Access? Well, Freedom Open Access is actually the Freedom Plans. The Freedom Plans, which are on the Funding Advantage, we wanted to give you a product that is easy to explain. It provided you with a support team that hasn't been there, has been there before, but it's been in a different phone numbers and different extensions. We're giving you one phone number for support for your Freedom Open Access plans for your members. We're branding it. We're taking our 20 years of expertise in reference-based pricing, and we're providing you with a brand that is backed by Allied's experience. It's still leveraging reference-based pricing. It's still leveraging the above Medicare, 125% of Medicare allowable for providers, 150% of Medicare allowable for facilities. But that's not all we have. We also have had many years of working with providers and having direct contracts. So one reference-based pricing plan is not like any other reference-based pricing plan. We have done a lot of work providing direct contracts with providers who have typically said, I'm not going to take that. We go to them, we ask, what would you take? And then we provide them with a contract. So we've done a lot of work on that front. So if you've tried reference-based pricing before, I would, encourage you not to think about that experience and come and look at the new experience. And then best of all, we have an enhanced dedicated member support and advocacy teams. So what are the advantages for you? Basically, this is a brand. So what we've done is that reference-based pricing is a claims reimbursement mechanism. And we've tried to mainstream reference-based pricing to employers and employees, and even to you as agents. So we're trying to make this easy for you, because the reference-based pricing is only a part of Freedom Open Access. Yes, it's a great cost saving. It's a great cost savings mechanism for the employer, and it's a great cost savings mechanism for the employee, but that is only part of Freedom Open Access. Freedom Open Access is now what we're providing you with tools. We have new tools for you so that you can provide your employer with a brochure that talks about all the benefits of Freedom Open Access. It compares Freedom Open Access to PPO, national PPOs. It takes away the myths that are out there about Freedom Open Access and really explains it into a comprehensive piece that you'll feel very confident giving to your employer and that they will understand. We're giving Freedom Open Access a logo, and that logo is going to go on the ID cards. So now there's that recognition with that logo that we're going to start building with the providers. They know that we have direct contracts with them, but now they're going to see that Freedom Open Access, and that's going to mean that, that it's more recognition at the provider. Then we're going to give you one phone number for all member support and for advocacy. And then don't forget, our Freedom Open Access plans include balance bill protection. So anytime that you talk to, when I talk to an agent and I say, oh, we use reference-based pricing, they go, oh, well, that's great. But what about the balance bill? Well, we protect your members from balance bill. And I'm going to go over that a little bit. And now we even have a flyer that you can give to your employer that they can give to their employees so they know how to use the balance bill protection so that they can make sure that that's used if they need it. And it provides you with a product differentiator. You can put this on your sheet, your spreadsheet, and show them the difference between the Freedom Open Access with all these benefits we're going to talk about today, and then the difference with the PPO rate. You're going to see about a 15 to 25% rate reduction going with the Freedom Open Access over the PPO. So, some things to think about, again, giving you something new in your portfolio that you can talk to your groups about. And really the ease of in the marketing materials that we're giving you and just naming it Freedom Open Access, it takes away that game of telephone, right? Like I tell you what reference-based pricing is, you tell the employer tells the employee, and we have no idea what the spouse hears, right? So it changes, people hear what they want to hear. Now we have Freedom Open Access. It's in the name of our products, and we also have material to help you support that. So how it works, member can see any provider of their choice, right? Freedom, Open Access, claims based are on the percent above Medicare that we had said before, 125% of Medicare allowable for providers, 150% of Medicare allowable to facilities. There's no benefit differentials between in and out of network because it's open access. So you don't have a different co-insurances, based on in or outer networks, or different deductibles based on in and out of network. There's an advocacy team that's going to support the members throughout the process. If they need help finding a provider, or they just want to make sure that, they have a provider that works with Freedom Open Access, they can call the number on their ID card. We'll help them find a provider. We'll even make their appointment for them if they want. If they get a diagnosis they're not really sure of and they don't know where to go, they can call that number on the ID card and someone will walk them through it, give them the best ideas of where to go to get that treatment, where it's the best price, but also the best quality of care. And then the balance bill protection, which we're very proud of, and balance bill protection, again, we guarantee that that member will not pay any more than what their contract states for a bill from the provider. So let's talk a little bit about the member advantages and the advocacy and member support. It's personalized hands-on member support. So again, they're going to guide you through finding a provider. They're going to guide them through care decisions, treatment options. They're really going to help them with all that. There's embedded cost containment programs that we have and we've built based on the needs of our members, but we really haven't communicated that to you so that you can communicate that to your employers of the benefits that are added into this Freedom Open Access plan. It's the high cost drug management plan that we have. It's a behavioral health plan that actually looks at our claims and detects if someone is, maybe needs some mental health support, and they'll make outbound calls to those people. And so it's proactive in that respect. We're going to have, we have diabetes and hypertension and weight coaching, all these programs you probably didn't even know we had, or maybe you knew because one group needed to use it, but now we're packaging all that together under the Freedom Open Access. Provider lookup, and again, the balance bill protection. Here's just a visual of all of those services that are included in the Freedom Open Access and the member support. And think about this, we're helping the member go to the provider that is not only going to give them quality care, but it's going to be the best price. We have no cost advanced imaging at certain, providers, and we can get that to them. So that saves the member out of pocket costs. It also is going to save the group and the employer a claims cost. So let's talk a little bit about balance bill protection real quick. So basically balance bill protection, how it works. A member goes and has a provider service done, and then the provider files a claim with us. They'll get an EOB after that service, and it'll say, this is what the claim was, this is what we discounted it, and this is what we paid, this is what you owe, based on your deductible, co-insurance, your contract. They pay that, and then the provider sends them a bill. It says, no. Your insurance company didn't pay me enough money. You owe me this additional money. That's a balanced bill. So what they need to do, and we're not going to know that they got that. So what we are saying is let them know to contact us. They can call us at that one number, or they can email the bill to balancebilling@alliednational.com. We're going to take that bill and we're going to start those negotiations with that provider. And we're going to negotiate to get to a reasonable and customary, payment for that procedure or that service. Once they agree upon that, we're going to pay that. We're not going to charge the member. The member's not going to be charged for that. But then we're also going to say, hey, we want you to sign a contract with us, a direct bill contract that says if someone comes in for this service under the Freedom Open Access, you'll accept this payment with no balance bill. So that's how we get a lot of our contracts, by doing that. And the reality is 99% of the reference-based pricing claims are accepted. So less than 1% of our claims are balance bill. So we handle everything. There's no charge to the member. So the member is never responsible for anything that's above what their contract states they owe. So that's a pretty nice protection to have for you to be able to talk about this. So some of the myths or some of the differences between traditional PPO and Freedom Open Access. Of course, traditional PPO, we know they're varying networks. They have higher and less predictable costs. Because basically it's up to the provider or the facility to decide what they want to charge. And they can charge anything above Medicare. So their average discount on a PPO claim is about 49%. And the average discount on the Freedom Open Access claims using the reference-based pricing is an average of 69%. So already now you're seeing the savings that someone on that Freedom Open Access plan is going to have. The traditional PPO has in and out of network penalties. Freedom Open Access, they can go anywhere they want. There's no penalties for provider selection. There's really, on the traditional PPO, you have a lot of plans now too. You have to go in network, or you don't have any coverage for out of network, or it's very, very little, coverage. And this just simplifies the Freedom Open Access, just simplifies the member experience. They don't have to worry about that. They don't have to worry about, oh my gosh, what's my deductible or what's my co-insurance if I don't go to a certain provider. So again, we're trying to make it easy. We're helping them cut costs, not only the employer, but the employee cut costs. And again, the Freedom Open Access plans are typically about 15 to 25% lower in monthly premium costs than the PPO plans. Again, another cost savings for the employer and the employee. So that's the full Freedom Open Access. We also have a plan which we call the hybrid plan. And that is really, it's a great traditional plan if someone is on a fully insured traditional PPO plan, they're going level funded, and you really want them to go to Freedom Open Access, but man, that's a lot to take in. So we created this hybrid plan to kind of ease the transition to going over to those total open access plans. So what we did is we combined the familiarity with traditional PPO, going to the doctor, showing your ID card, PPO, pay your copayment, that's PPO. You can look at a network, see if they're in the network. But then when we really want to control the cost is for those larger claims, right? Facility claims, surgery claims, those type of claims. Those are the ones that we want to try to control the cost or give that deeper discount. So what we do is we wrap that provider only network with the reference-based pricing or the Freedom Open Access plan, so that now that member not only gets to go to the network that they're used to for their everyday expenses, but they can also get all the benefits we just talked about with the Freedom Open Access plans. They get all those extra services. They get that discount, the average 69% discount for all those larger claims. So they're getting the support that they need when they need it. And so I thought this was interesting because the claim volume percent is higher for provider claims. So most people are going to the doctor. That's most of their claims. They're going, whether they don't feel good, preventative, whatever that is, 85% of the claims volume is provider claims. 15% of those claims are your higher price claims, your facility claims. The claim spend, out of those high number of claims, only 40% is on the claim spend. The smaller number of claims is 60% of the spend. So it's that 60% that we want to help cut the cost of for the plan, the employer, and also for the member. So So how it works, for routine care, smaller claims, you go to the provider network. For facility care or higher claims, you have the Freedom model. You can go to any provider you want, and you can, and you're going to get all the advantages that we talked about from the Freedom Open Access. You're going to have the advocacy team that's going to support you, support the member every part of the way. You're going to have that pricing transparency, and it's going to be a lower cost and a higher value. And you're going to get all those value benefits as well to help maintain or control those higher price claims. So really, I say it's the best of both worlds, because you have that familiarity of going to a provider network for your everyday, I have a cold, or maybe it's a little bit, you need to see a specialist, and now you can use your network, you can look it up like you're used to, you can go to a network provider, but then all your other claims, your bigger claims, are open access. You can go anywhere you want. Now, what if you want to go to the doctor and they're not in the PHCS or Prime network, which is what we use for the provider only networks? What if they're not in that network? Well, you're just going to get reference-based pricing. Your benefits are going to be the same, but you're going to get the advantages of the Freedom Open Access plans. So again, you can't really lose on that plan. It's a great transitional plan. So if you have an employer that's on a fully insured plan, traditional PPO, we've got that. If you want to say, okay, let's do this in baby steps. Let's go to level funded. We're going to save you a lot of money going to level funded, and we're going to keep your traditional PPO. So you're going to have a traditional PPO plan. We've got that for you. We've got the Cigna network, it's national network. We also use First Health, and we have PHCS, and we have some regional networks as well. Okay, now we want to move, we're going to get more cost savings. Well, with little, kind of little disruption, let's go to the hybrid plan. Still go to your provider, and then you can go anywhere else for your larger claims, because now you're going to have Freedom Open Access. Oh, and by the way, you get all these additional services with that Freedom Open Access. Then now we really want to save money, and we want to get, our employers the best that we can give them. We're going to go to Freedom Open Access plans, where they can go to any provider and get all of the benefits that we talked about today. So what did we do? What are we doing for you to help you? We've changed our website. If you haven't been to the Allied website and you haven't gone to the Agent Edge, which is the agent portal, you should go check it out. We've made a lot of great changes. We're trying to make it super easy for you to find what you need quickly. And so we've kind of taken all of our information and streamlined it for you. And so the website's different. We hope that you can find what you need quickly, and you can get the supporting documents that you need for this product. We've also added some new marketing materials. We've got a Freedom Open Access Broker Guide. It's a great guide for you to have. I think I have it on my desk, and all of our account executives have it on their desk, just for reference, and just, it's just a great piece to talk about Freedom Open Access. We have a balanced bill protection flyer. Give this to your employer, let them give it to their employees. It's a great piece that explains how that works. We have a new funding advantage flyer, so you don't have to have that big bulky brochure anymore. You just have a flyer, and it has all the information about our products, and we can customize that for you. If you're going somewhere, we can put your information on it. And then we have a very nice looking product availability, state availability chart that I think looks super nice. So again, trying to make this easier for you so that you can get the word out. Now we are going to have new ID cards. So starting this summer, starting with 8/1 effective dates, we are going to have new ID cards. Now, if you have an 8/1 effective date and it gets issued today or tomorrow, they might not get that new ID card, but we are going to reissue new ID cards, and you'll see there with the Freedom Open Access logo. And so we're really excited about that. The one phone number for members to call, so that they have that as well. So just to sum everything up today that I talked about, sorry about the rocky start this morning. We think this is a complete solution. It's a smarter strategy for today's market. Traditional level for traditional fully insured PPO networks is not working. So it's up to you to kind of find solutions that can help your employers. So the Freedom Open Access plans, which is the full solution, and we also have the Freedom Hybrid, which is that transition strategy that will help you save premium dollars and also give you that great 69%, on average, 69% discount on claims. Again, it's built on the plans from Funding Advantage platform. Plans haven't changed. We're just adding to them with all these services and the branding of the Freedom Open Access. Remember, premiums with the Freedom Open Access are about 15 to 25% lower compared to PPO plans, with the average claims cost of 69%. They're more predictable and stable and with a cost structure. So your retention, your renewal is most likely going to be more stable, right? Because it's more predictable with that discount, and which will reduce your long-term cost trend. So all the way around, great benefits. So thank you for your time today. I really appreciate it. If there are any questions, I don't see any big questions. Again, if you have any questions, feel free to add them to
Robin,
the submission box.
I see a few questions here.
Okay.
It says, did the login location change for the website? I just looked and I don't think I'm seeing it.
We will get you where the login is. I don't know. I will send that to you and get that for you.
All right. And then it says, are you eliminating the Freedom Choice program and 6% discounts?
No, we are not.
And is the 69% discount applicable to facilities that are contracted with Allied or all?
So the average of the 69%, so it's an average, 69% discount is for Freedom Open Access. Yes, whether we have that contract with them or not. So it's an average. So it's not every single claim is going to be 69% discount. It's an average. So if we have a contract with that provider under Freedom Open Access, it might be a little bit less than 69% because they want a little bit more money. But on average, it's 69%. And I'm sorry, just one thing. If you go to Agent's Edge, and the very first button on that page says login self-service portal. That's where you go to log in. Anything else?
Let's see. Will brokers have access to client utilization on statistics?
Well, there are utilization reports out there for the employer, so the employer can access those utilization reports and see the discounts that they're getting on the claims. I think that's what they're asking.
Oops, one more.
Okay.
So no balance billing with facilities on hybrid plan when member deductible and when, so no balance billing with facilities on hybrid plan when member deductible and coinsurance is met.
Nope. So the no balance bill protection is regardless of if their deductible and coinsurance is met. So a balance bill is we paid the facility based on our 125, 150% of Medicare allowable. We paid them. That's what they got paid. The member has to pay their responsibility of that bill. So they'll pay whatever their deductible or the coinsurance says they have to pay, and that's done. But now the provider comes back and says, oh, well, you only paid, your insurance company only paid me 150% of Medicare allowable, and I need 300%. So that they're billing after the fact. That is a balance bill, and that's what should be sent to Allied. Now, I'll be honest with you, as a salesperson or agent, I would, if anybody has a question, they can just send it over and we'll look at it, and an advocacy person can reach out to that person, walk them through the EOB, let them know what it is, if it is a balance bill or if it isn't. And honestly, a lot of the emails that the team gets are people not realizing they have to pay their deductible. So, less than 1% of our claims are balance billed, but they do get a lot of, inquiries should I pay this or should I not pay this? So, send it to, if they have any question at all, if they already paid, and now they're getting another bill, they can definitely send that and we can look at that and walk them through it.
Robin, we have another question. How have renewals trended for your client base under these models over the last few years?
So they have trended lower than our PPOs. Right now, we're running at about, I would say, between 8 and 10% on average.
And another question, few, if any, of my clients use utilization reports. Can a broker access the reports in order to show the clients?
I need to look into that. I do not know if you have access, but I'll look into that for you and we'll get back to you on that. And if you can, I'll put the link out there, like where you could, I'll tell you how to get it to it from the broker portal.
Question, is GLP-1s impacting the renewals?
GLP-1s typically are not included. And yes, if someone goes onto a GLP-1, it's expensive, then yes, it will affect the renewal. Drug cost is a big influencer on the renewal. But that's why we have the high cost drug program. So if we get a claim in for a drug that's over $500, we then reach out to that to that member and say, hey, let's try to source this high cost drug somewhere else. Let's try to see if we can get it from the manufacturer, source it, from another overseas or Canada, and see if we can get a better price for you on that. That has saved a lot of money and helped the renewals when it comes to the high cost drugs.
That seems to be it for now, as far as our questions.
Great. Well, thank you everybody for being here. I really appreciate it. We will take your questions. We'll answer them for you. We'll send out the presentation for you. If you have any questions, please reach out to your account executive, or you can reach out to myself, and we're happy to help. So thank you so much for being here. Look forward to working with you.